attached bone to bone, right? So lateral ligaments in ankle joint. How many ligaments are there?
In ankle joint.
Yes, in ankle joint, lateral side.
Malleolus,
Any,
lateral
how
malleolus.
many ligaments? Any idea? It is just one testing question. So there are
2, 3.
three ligaments are there, right? So you can see here, this picture, there are right, spine injury to ligament. So there are 3 ligaments. This is the first ligament. That's why it is called anterior talofibular ligament. So as it is situated anterior, plus it is connecting with talus here, talus to fibula. So that's why it is called anterior talofibular ligament. Second, when you see here, this one, right, posterior talofibular ligament. So a ligament which is there posterior side, which is attaching, right, talus and fibula. So that's why it is called posterior talofibular ligament. Third one is calcaneofibular ligament. So there is no anterior or posterior. Why? Because it is only one ligament. So which is called calcaneofibular ligament. So which starts from calcaneum and fibula. So both, all 3, you can see fibula is second. So the fibula is second. So ligament starting from tarsal bone going to fibula. That's why it is called anterior talofibular, calcaneofibular, posterior talofibular. So ankle joint. What are the articulation of ankle joint? Which 2 bones are forming ankle joint? Okay. Which 2 bones are forming knee joint? Knee joint.
Femur.
Tibia
and femur.
Okay. Which 2 bones are forming ankle joint?
We have tibia and
Talus.
Talus.
Yeah.
Yes, tibia and talus. That's why this joint ligaments are called talofibular, because this lateral side we are studying. If you see medial side, different name. But as we study lateral ligaments, so laterally there is a fibula bone. That's why talofibula, calcaneofibula, all this. As we are discussing the bone talus, one more point for you about bone. Okay, this is also out of your syllabus. Okay, still I am telling, but your information for your knowledge, right? In our body, only one bone don't have any attachments. You know what is attachment?
Yeah.
What do you tell me? Attachment?
Connection.
Connection means?
With bones or ligaments or.
I am telling muscles.
Uh.
So in only one bone, no muscle will start. That means originate. In only one bone, no muscle ends. That is insertion. Which bone?
Callus?
Talus bone.
Talus or callus?
Talus.
Talus, yes.
Talus is the bone, no muscle starting from the bone, no muscle ending to the bone. Okay, doctor, what is there? Any problem? If not ending, not starting, there is a problem. Why? What you know? When muscles are starting or when muscles are ending, then there will be a muscles nerve blood supply to the muscle. That blood supply to the muscle which will enrich, which will increase blood supply to the bone also. You understand?
Yes.
You agree? Understand?
Yeah.
When arteries or capillaries supply muscles tendon, that will give blood to bone also. You understand? But so because of that, for example, my humerus got fractured. Now, after the fracture, healing should happen. For healing, what is very, very important?
Hematoma.
Blood circulation. More blood should go than hematoma formation. Yes or no?
Yes.
Less blood is going. Do you think hematoma will form?
It's go blood and capillaries to.
Now, hematoma formation or healing for upper limb, how much time? Healing time, upper limb?
1 month and a half.
1 month and a half. For lower limb, how much time healing time?
3 months.
3 months. For face, how much healing time?
Less, I think.
Less. Yes. Why? Why like that? First, very, very less time in the face. Next, in the upper limb.
Is the medial?
Next, in the lower limb. Why?
Good blood supply.
Blood supply. Because of blood supply. Our face have more blood supply. That's why healing will be quicker. Then upper limb, blood supply is better. So next, faster healing. Next, lower limb. Blood supply is compared to upper limb, it is less. Compared to face, it is less. So healing time will be long. So blood supply will determine the healing. Yes or no?
Yeah.
So now a muscle is attached to the bone. Do you think more blood supply to the bone or less blood supply?
No.
More blood supply. That's what fracture humerus, it will heal faster. But fracture tibia, it will heal little less time. Imagine a bone like talus. A bone like talus. There is no muscular attachment. Do you think blood supply equal like other bone, or it will be less?
Of course, less.
Of course less.
Because
Blood supply will be less.
less.
So this situation, if there is a fracture in talus bone, right? Once there is a fracture, the remaining part is there now, the fracture part. It will not get blood supply at all.
Oh.
When there is a muscle attachment is there, then because of muscle artery, it will get blood supply. You understand?
Yes.
But one part, no blood supply at all. So when there is no blood supply, what will happen?
It will be no healing.
No healing.
No healing, death, necrosis.
Oh.
So when there is a fracture in talus, there is more chances to develop avascular necrosis. That's what's about. I want to tell you, talus bone. So whenever you treat patients, in case they get talus fracture, fracture, if you treat, you should keep this in mind. Or talus fracture, right? You should keep this in mind. Based on that, you can discuss with patients, you can discuss with doctors. You understand?
Yes.
That's what I want to tell about the talus bone.
Okay.
Similarly, here, which bone? Scaphoid also.
Scaphoid.
Blood circulation problem is there. So any fracture to the scaphoid also, there is more chance to develop
Most common
necrosis.
fractures is in the scaphoid.
Necrosis. Right? So orthopedicians will see more care, more attention when they do surgery for talus fracture. When they do surgery for scaphoid, no, they will be more serious because chance to necrosis. Understand?
Yeah.
Okay. So there are three ligaments, these ligaments, so we're going to see. So directly we will see the special test. Yes, there are two special tests. One special test is called anterior drawer test. The second one is talar tilt test. So in your blackboard, there is a description of this test is given. Description is there already, but anyway, I will show you how to do. So this is the method of testing. Hold the tibia and fibula, stabilize the tibia and fibula, and have another hand like a cup. Hold in the calcaneum and draw it anteriorly. So when you draw, keep the ankle 20-degree plantar flexion. When you draw, check whether there is an excessive anterior translation or not. This test will identify only in case of injury to anterior talofibular ligament. That's all. If injury to calcaneofibular ligament, this test will not give idea. This test will not give idea. Right? This test, if injury only to anterior talofibular ligament, then this test will identify. Okay? Can you come here? So stabilize here, right? So 20-degree plantar flexion. Right? Then have a cup here, hold it, and then draw is anteriorly. Draw anteriorly, anterior drawer test. Now check whether there is excessive translation anteriorly or not. Okay, right? So when it is excessive translate anteriorly, of course, we should do first normal side. We should do first normal side. Here, we will do first normal side. Right? 20-degree plantar flexion to anterior translation. Okay. Then you come here and check. Right? So when you keep 20-degree plantar flexion, this ligament is anterior talar ligaments now getting stretch. Then when you pull it, if it is excessive translate, then test is positive. Okay, this is test 1. Test 2, talar tilt test. How it is? This test will identify this one, calcaneofibular ligament, calcaneofibular, middle ligament. How? So talar tilt. So you have to tilt the talar, tilting like this. So when this ligament is injury, right, there will be excessive inversion. Again, you should compare normal side to injury side. So talar tilt test like this. Okay. So if it is excessive inversion, it indicates positive of test. Okay. So after doing special test, now directly we are going to rehabilitation. So when rehabilitation, again during the practical exam, you should do any 5 range of motion exercises for ankle joint, any 5 strengthening exercises for ankle joint. So when you come practical class, you should demonstrate special test. After the special test, you should demonstrate any 5 ROM exercises for ankle joint, any 5 strengthening exercise for ankle joint.
Doctor, even if the sprain was 3 degree?
Even a sprain?
If the sprain was 3 degree, we have to do strength exercise and range of motion.
See, exercise, everything is a part of rehabilitation.
Yeah.
Anyway, once like grade 2, grade 3, doctors may think for surgery, right? Or grade 3, definitely surgery. Or grade 1, if it is grade 1, then doctors will immobilize for some time without surgery. So everything, this rehabilitation, everything post immobilization. Post immobilization, right? What practical is required for immobilization? Anyway, you are going to tie the joint. Yes?
Yeah.
So that's what directly I am jumping into exercises.
Yeah.
You understand?
Yes.
So exercises, right? So that's what you have to do special test. After doing special test, I need from you any 5 range of motion exercises for ankle joint. Because this particular injury, the doctors will immobilize the ankle joint only. So after the immobilization, they remove the bandage, right? Ankle joint, definitely there will be a restricted range of motion. So as a physical therapist, you should give exercises to increase the range of motion. Yes, 1 week, 10 days, I am giving exercise. I improved now range of motion. Now after range of motion, now I have to go for strengthening exercises for ankle muscles. So this is the concept, right? So do you remember last week we studied range of motion exercises for ankle?
Range of
Last week.
Yeah.
Ankle, knee and shoulder.
Yeah.
So that those exercises applicable here also. Understand?
Yes.
Right? Do you want me to show again?
Special test?
No. Range of motion exercises.
No.
It is there already.
Oh.
It
Yes,
is there
yes.
already in the last week class.
For ankle.
In this also it is there already.
Okay.
Range of motion exercises. Stretching calf muscle, stretching the anterior tibial muscle, stretching the inverter muscle, stretching the everter muscle, stretching the intrinsic muscles of the foot, stretching the fascia,
Yeah.
all this. Okay? This is the range of motion. Strengthening, we told TheraBand.
Yes.
For dorsiflexors, for plantar flexors, I will give to you. Remember?
Yes, I am.
And the inverters, oblique, everters, oblique.
Apply resistance.
Apply and towel exercises,
Yeah.
pickup exercises. These
Yes.
are strengthening
Goal,
exercises.
exercise.
And range of
Anything related to ankle, doctor.
alphabets.
Yes.
Yeah.
Anything
Range of
related to
motion
ankle.
exercises. Oh, like that.
Anything.
Okay.
Anything related to ankle.
So today, one is ankle ligament injury,